Welcome back to another episode of the PMU Entrepreneur Bible. This is Chapter 5, Part 2. If you've made it this far, hit the subscribe button and make sure you like our content to hear more chapters when they are released in the future. Now, Chapter 5 is one of our biggest chapters in this book, and that is because we are talking about sanitation and sterilization. Where we left off was talking about the need for using gowns while doing a permanent makeup procedure. Now, back before COVID, when I first saw artists applying a full gown and garb to tattoo, I saw it as overkill in addition to the cost and trash that it created at the end of the procedure. Unless you're required by regulations to perform permanent makeup or paramedical tattoo services with a gown, hair, or shoe coverings, it's unnecessary to apply all of this PPE to you and your client, and quite honestly, it's a mostly non-invasive, non-surgical procedure, so all of that is really unnecessary. That being said, if you perform 3D areola tattoo procedures, you will want disposable paper gowns on hand for use with clients that must remove their top in order to receive the tattoo. These gowns will keep the client warm and more comfortable, especially if they must step out into a shared workspace to use the restroom in the middle of the treatment. The disposable paper gown will also be a cleaner alternative against cross-contamination from the client's clothes, and especially protect from any ink splatters on the client's clothes that may stain them while we work. Disposable paper gowns are inexpensive to purchase in bulk and can be found from medical suppliers or through Amazon. It's important that we discuss how to protect ourselves from bloodborne pathogens, but we also need to classify and understand the types of bloodborne pathogens that we may encounter during a PMU or paramedical tattoo procedure. Bloodborne pathogens are most commonly discussed as the life-threatening viruses that we may encounter, but they also include the bacteria, fungi, parasites, and yeast that may potentially be present in and on the individual's skin or in their blood and body surface. While bloodborne pathogens are frightening, it's more likely that you're going to encounter the most common harmful bacteria transfer during a cosmetic tattoo procedure than something like HIV. Staphylococcus aureus bacteria is the most common cause of any bacterial skin infection that creates an abscess, a boil, cellulitis, folliculitis, or impetigo. There are more than 30 strains of Staphylococcus bacteria, with Staph aureus being the most common pathogen that causes disease. Staph infections can infect any area of the body, including the skin around the mouth, and staph infections must be treated with antibiotics prescribed by a healthcare provider, or it will continue to worsen and spread to the bloodstream, causing sepsis, which can be deadly. If you have clients that work in healthcare, make sure you remind them to be extra diligent with their aftercare, as they may be more exposed to MRSA or methicillin-resistant Staphylococcus aureus that is spread on the work surfaces and on their clothes as they care for infected patients. If you want to prevent the spread of staph infections in your tattoo shop, be sure to use paper towels that are disposed of after each use to prevent spreading bacteria on reusable cloth towels. Be sure to cleanse your client's skin with a minimum of 70% isopropyl alcohol for at least 10 seconds before applying your stencil and beginning tattooing. Be sure to wipe all of your work surfaces with a hospital-grade disinfectant before and after the tattoo treatment for the recommended dwell time on the bottle. And don't dilute any of your cleanser unless it's recommended in the specific instructions by that manufacturer. Remind the client to perform hand hygiene prior to applying their aftercare and to change their bed sheets regularly during the healing process, especially if they share their bed with a pet. If your client develops what appears to be any sort of infection with increased redness, heat, swelling, or pain, you must refer them to a physician to determine if this is an allergic reaction or infection requiring the treatment of antibiotics. Depending on the bacteria causing the client's PMU infection, simply using antibacterial cream as aftercare will not necessarily address the infection and may actually cause it to worsen by creating resistance to the antibiotics that have already been used. It's unlikely that the client will develop a fungal or a yeast infection during the course of their tattoo healing process. However, the wound area may be kept warm, moist, and covered, contributing to an environment that may grow yeast. Yeast infections will most commonly occur on or near the mucous membranes. Common symptoms include a rash, white or yellow discharge, and intense itching. Yeast infections must be treated with an antifungal preparation, as antibiotics will only treat bacterial infections. Clients who received a lip blush treatment will be most at risk, since the mouth is the most common mucous membrane-like area that we will be tattooing. You must inform your client that kissing and intimate relations are prohibited in the 7 to 14 days post-treatment due to the risk of infection. If the client develops signs and symptoms of infection, you must recommend they seek an oral prescribed treatment, as any topical treatment may negatively affect the ink coloration or retention in the tattooed area. Be careful recommending any olive oil-based aftercare to your clients, as olive oil is used as a medium to grow yeast in lab experiments, and therefore may not be the best choice for your clients healing from lip blush. While parasitic infections are incredibly rare during the tattoo healing process, they are at higher risk if the client is sharing a bed with a pet or has poor hygiene practices. Signs of a parasitic infection include itchiness, eczema, inflammation, skin discoloration, papules, and additional wounds caused by excessive skin scratching. Remind clients that sleeping with pets may be best to avoid or sleep alone that week, or regularly change bed sheets to prevent the spread of ringworm or other environmental infections. It's also important that clients understand they cannot swim, use hot saunas, hot tubs, or share towels while healing from a tattoo, as these can all become sources of potential infection. If your client enjoys time hiking in the wilderness or gardening, they should be washing their hands thoroughly, especially under and around the nail beds, to eliminate any environmental parasites they may encounter. Now let's discuss the most fearful components of any bloodborne pathogen discussion, which is the viruses. Let's begin with the viruses most commonly found and spread via the skin surface, which is the herpes virus. The herpes simplex virus is also known as HSV and commonly causes contagious sores around the mouth, nose, and genitals. Herpes infection on the mouth will erupt along the border of the lip and lip skin. Oral herpes is spread through close contact, such as kissing and sharing drinking glasses. The most common way herpes is spread through tattoo is not via necessarily infection, but the eruption and cause of infection caused by a dormant virus that already lives within the client's skin and nerves that becomes irritated during the tattoo process. In the tattoo setting, you will prevent the transmission of the herpes virus by using disposable paper towels, by using disposable makeup brushes for the lip blush mapping, routinely wiping all of your work surfaces with hospital-grade disinfectant before and after the service for the appropriate dwell time, and ensuring that the client has been taking an appropriate prophylactic prescription for antiviral medications before you perform the lip blush treatment for at least 3 days during the day of and 3 days after treatment. Now, if you've made it this far, I want you to hit that subscribe button, like, and leave a comment, because we are only about halfway through Chapter 5 on sanitization and sterilization, and we have a lot more to go. So make sure you stay tuned for Chapter 5, Part 3, and thank you for joining us here on the PMU Entrepreneur Bible, where you are learning to accelerate your skills now.